Check, check. Good morning, everyone. Good morning. Good morning. Good morning. Good morning. Good morning. Good morning. Thank you again for meeting us here this morning. We are going to get right to business. Alex Baudre is here with us from USI, which is our broker for insurance. He's going to be running through a series of different things that are going on throughout this time. The amount of content that he has to cover in this time is about an hour's worth of time, so we're going to try to kick that through in 55 minutes. We are recording this as well, so that spouses or other loved ones that need to see this, that weren't able to be here this morning, and you can also watch back. We'll get that out to all of you, so that is available. The other thing we're going to do is create a frequently asked question doc, so that after, if we can't get to questions, you can put those questions in that frequently asked question doc. Alex will take those on and answer as many questions as he possibly can, as well as him being available to contact him for other information as well. So without further ado, I'm going to turn it over to Alex to walk through the components that we're looking at for insurance moving forward in North Fond du Lac. Alex.
Good morning, everyone. The other thing I'd like to say before jumping into is, as we get closer to January 1st, so other than the prescription drug change through SmithRx, which went into effect on September 1st, everything that I'm going to talk about is going into effect for January 1st when your insurance renews. As we get into the October-November timeframe, we will go through open enrollment as you do every year, and there will be more information available then as well. We'll do either more in-person meetings like this or virtual meetings for you and your spouses to attend. So please do know that we have a lot of lead time leading up into January 1st, but it is important that we answer all of your questions. Normally I do like to take questions during the presentation, because if you have a question, it's likely that one of your coworkers also has a question. However, with the time and the amount of content, I don't know that we'll get to that, but you can always contact Maria or Matt. They have my contact information between myself and Eric Wolfmeyer, who's on my team. We'll do our best to get those questions answered timely. So there's three main topics I want to cover. Family savings plan. This is I call it the world's nicest spousal carve-out program. This is an opportunity for you to go on either your spouse's insurance, or if you're under the age of 26 and you still have access to your parents' plan, or even if you're single and you work another job that offers insurance, this is an opportunity for you to go onto that health insurance plan, another group-sponsored health plan. You get a $150 a month stipend, and they will cover all of your out-of-pocket costs, your deductibles, your co-pays, your co-insurance. So you can have a $0 health plan by moving to that plan. Okay, this is in effect today. You have access to it today. If you are eligible, all of these slides will be available. And Maria sent this slide out as well. But if you are eligible, so if you have access to another group-sponsored health plan, you will be required to meet with a network health representative. That schedule, that calendar should be going out very soon, or it is out. It's out already, so please sign up for a time slot. We are taking attendance. It is a requirement for you to meet with them. The meetings will take anywhere between 15 to 25 minutes, and what they're going to do is they're going to go through your individual situation, talk through it with you, and if it makes sense, you can take advantage of this program. If it doesn't, and it makes more sense for your individual family situation to remain on the district's health plan, totally fine, but we want everybody to have the opportunity to meet with a healthcare representative to figure out if this makes sense. Again, what we're trying to do and what the theme of today is how do we offer better benefits, but also reducing the district's costs, because our costs have gone up dramatically over the last few years. So we're trying to keep your premiums as low as possible while offering better benefits. We're not trying to gut the health plan, okay? So again, reimbursed up to 100% of your out-of-pocket costs, so all of your deductibles, co-insurance, co-pays, plus a $150 a month stipend. So again, more information coming out on the family savings plan, but really an opportunity for you to increase your benefits and have $0 coverage. I'm sorry, I'm skipping through most of this because you'll go through this when you meet with the network health folks. Quickly, any questions on family savings plan? Yeah. question was, her husband has access to other coverage, they currently don't take it, do they still need to meet with Network Health Plan? Yes. If you are eligible in any way for this plan, you must have a meeting. That may not change your circumstances, but we'd still like you to have the meeting with the Network Health folks. Okay, moving forward to what is new and what is changing. So last month, the school board approved the plan changes that are on the screen here, and they're going to be in conjunction with the Garner Health Plan, which I'm going to talk about in a moment. I see some folks taking pictures. Don't worry, the slides will be available, so we'll make sure everybody has access to them. Your deductible today is $500 single, $1,000 family. That is changing to $2,000 single, $4,000 family. So $500, $1,000 today to $2,000, $4,000 January 1st. We're going to talk about how we can get that deductible down to $0 in just a moment, but please note that that is going to change through UMR. The other piece that is changing is you have a 5% coinsurance today. Okay, so after my deductible is met, you would be responsible for 5% of the remainder bill up until your out-of-pocket maximum. That is going from 5% to 10%. Okay, the 5% benefit, just to be fair, is a very unique benefit in the insurance marketplace. 10% is usually the minimum, so we're bumping that up to get in line with the insurance norm there. Everything else is remaining the same. Your out-of-pockets have stayed the same. Your prescription drug copays are all staying the same. It's just that the deductible is going up and the coinsurance is increasing. Okay, so I talked about that deductible going up. We are implementing Garner, which is a health reimbursement arrangement. It's a data and analytics company that's going to help you find the absolute best providers within your area that are accepting new patients. If you engage with this program, that $2,000 single, $4,000 deductible will go to $0. Okay, so again, the theme is how do we create engagement in these programs to offer you a richer benefit so you can get that deductible down to $0, but it's going to take some, engagement on the part of all of you. So this slide, I think, does the best job of what we're trying to accomplish here. This is a study done based on surgical site infections after colon surgery. And the big bars on the left are 4 different hospital systems. So you have Hospital A, Hospital B, all the way to Hospital D. And the infection rate at the best hospital, Hospital A, is let's call it 12%. And Hospital D, which is the least performing, is at, let's call it 18%. So by hospital system, you can see the different outcomes. Hospital A being the best and Hospital D being the worst. The smaller bars on the right are the individual doctors and their performance. So Hospital A has the best 2 performing doctors, but Hospital A also has the second worst performing doctor. So what we are trying to accomplish is to give you all the data and the information to help you locate those best providers. Because in healthcare, when you go to a better performing provider, the costs actually come down. I always think of, if I go to Best Buy to buy a TV, I don't want the least expensive TV because it's generally, not the best TV. Healthcare does not work that way. If I am going to a top performing doctor, I have better outcomes, I have lower recidivism rates, lower infection rates, those costs are actually able to come down. Okay? So what we're trying to do is we are trying to get all of you to go to the top 20% performing doctors within your network. Okay? So we're, again, giving you information and data to help you make those choices. We will only send you to providers who are accepting new patients, so it's not like we're going to try and get you the best doctor, but there's a 3-year wait list. That's not what we're trying to do. But we're looking to get you all to go to the best doctors to get you healthier and get you better health outcomes with your care that you may need. So here's one example. It says meet Ann. Ann just found out she has diabetes. She knows she needs to see an endocrinologist, but she's not sure how to find one. So all you would do is you download the Garner app. I know I apologize, it's another app. I'm sure you all are loving downloading another app. But you get on the app, you search for an endocrinologist. They're going to give you several choices, and you can see on here there's 4 doctors listed with their score outcome and how far away they are from your location. You can click on that doctor. It'll give you almost like a Yelp review, so patient care outcomes, bedside manner, all of the data that you might need to make a provider decision. And you can then set an appointment, and the concierge will set you up with that appointment as needed. If you go through this process that Ann just outlined here, again, your $2,000 single deductible or your $4,000 family deductible goes down to $0. We will cover all of your deductible expenses. And if you should need a prescription out of that appointment, we will cover your prescription drug copays. Okay, so again, $0 if you engage with this program. One important note, you do not have to use Garner. We are not shrinking your network. So your broad network today, or if you have a doctor that you really like that you just absolutely don't want to switch, that is entirely up to you. We are not limiting the network choice. Your out-of-pocket is going to go up to that $2,000, $4,000 deductible level. Okay, so that's the big choice here. Do we get engaged with the Garner program? You don't have to, but then your out-of-pocket costs may go up. So the number one question I always get with Garner is how do they evaluate the provider networks? Are they just going to people that are giving them kickbacks, those types of questions? And the answer is no. So Garner is the largest medical claims data set in the United States. Their data is so good that companies like United Healthcare, who we have today through UMR, purchase their data set. Okay, so they get their data from individual insurance carriers, Medicare and Medicaid, as well as others. I think they have over 13 different ways of data sets, and they put that all together to create the algorithms that help identify top performing doctors. So you can see they have over 60 billion medical records on file and over 310 million unique patients represented, which is over 1,000 terabytes of data, which helps fit out the top performing providers in their app. Yeah, question? So the only time prescription drugs are going to be covered under the Garner program is if you set an appointment with a Garner doc for your appointment, and there's a prescription that comes out of that appointment. So if you're already taking, I don't know, a cholesterol medication, maybe not the best example, but go with me here. If you're already taking that medication today, your copay is not going to be covered unless that prescription comes out of your appointment with a Garner doctor. Okay? I hope that made sense. Yeah, excellent question. So let's talk about primary care for a minute, because probably that's the biggest piece of disruption. What happens if I'm seeing my primary care doctor and they're not one of the doctors identified by Garner? Two different solutions here. One is, I don't know about how you all feel, but if I found out that my doctor wasn't good, I don't know that I'd want to continue to see that doctor, so maybe I'd still want to switch. But let's say you have a phenomenal relationship with that doctor, you've been seeing him for years, and you absolutely do not want to switch. For your preventative exams, you don't need to, because that's still covered at 100% due to the Affordable Care Act. So your annual physicals, your age, gender appropriate physicals every year are covered at 100%, no matter what. That still is not changing. We have to do that required by federal law. What I would encourage you to do is, let's say you go to your annual physical and now you're being referred out to a specialist. And let's say I'll pick on Aurora. If I'm going to an Aurora doc, if they refer me, they're likely going to refer me to another Aurora doctor. That is where we would like you all to pause, go on Garner, and find a provider within that specialty that you may need to see, knowing that that doctor may not be within Aurora's system. It may be a Freighter doctor, it may be a Theta Care doctor, etc. But that's okay. You can switch systems back and forth, go to the top performing providers, get your deductible covered at $0, and go from there. I'm going to start here. Yeah.
For the Fond du Lac Oshkosh area here, are we losing access to a lot of doctors? Like, what's the percentage compared to what we have now? I mean, is it dropping or traveling that far distance, causing us to take off from work?
No, excellent question. So the question is, are we going to have to travel in order to partake in this program? The answer is no. So 2 points I want to address is the network, the access is not shrinking. You still have the same set of providers you're going to today. We're just trying to get you into the top performing doctors. Yes. So then the next question is, what about the top 35% or the top 20% of doctors that we're trying to get to? Remember, we're only going to show you providers within your area, within your network that are accepting new patients. So So it's a little bit of a sliding scale. We're always trying to aim for that top 20%, but you know, if the top 5% are full and aren't accepting new patients, that grid's gonna slide down. So that we're only showing you on the Garner app doctors who are accepting new patients. Yes.
The second half was, can you see Garner doctors, right, and receive that, reimbursement for that discount, and then the next time not, or is it all or nothing?
Yes, you can jump in and out. Just note that you may have out-of-pocket expenses if you don't go through Garner. But yes, you can jump back and forth. I'm gonna start here and then come over here.
So what happens when you go to your annual physical or your annual physical and you discuss other things? You always get that bill for like $60 and you're like, what's this for? Well, because you discussed your eczema at your physical. So if I go to my physical, that's my physical,
Mm-hmm.
but then they discuss something else.
Yep.
Now who pays for that?
So if you get a bill from the provider, it's likely going to be you. What I would tell you to do is push back hard on that provider and say, no, I was there for my annual physical. You need to recode this visit and get rid of my deductible expenses or my copay or whatever they're charging you for. If you go in for your provider and you ask a question, they really should not be charging you that. I understand, it does. The other example is, maybe I've had a colonoscopy in the past and I've had some polyps and now they want to see me more frequently than is required. You think you're going in for a preventative exam and they're charging you as diagnostic, that's also going to hit your bill. So the question to always ask the provider is how are they coding it? If it's preventative, it's free. If it's diagnostic, they're going to charge you. But I would push back on the provider more so than here. I think I opened a can of worms here. I'm going to do 2 more questions, then we do have to keep moving. So.
How are you defining all of your data, and what if a doctor BP shows up on the app and you already have an appointment with them, and you still go back and
Yes, so if you're already seeing a doctor, once this goes live, which you should have access to the app beginning around the beginning of December, and again, this is going to be live for January 1st. What I would encourage you to do is go on the app and search for your individual doctor. If you already have an appointment, you can talk to the concierge through the app and see if that doctor is within the network, and they'll get that appointment added, and you'll be covered at $0. What I would tell you is that roughly 35% of you are already probably seeing a Garner doctor. For 60 to 65%, it's going to require some disruption, just on Garner's book of business averages. Okay?
How big is our area that you're looking for doctors?
Generally, it's going to be within 10 to 15 miles, depending on the specialty. If you have something super specialized, could you be sent to Milwaukee or Appleton or Madison? Maybe. But for primary care, your typical normal specialties, it should be within your normal driving distance. All right, last question, and then we are going to move on.
Okay, going back to the prescription, if I would have a prescription for metformin and diabetic. If my refills run out and then prior to going to my regular doctor to get my prescription refilled again, if I go to a Garner doctor, is that not covered?
Yes.
Okay.
Okay. I apologize for not getting to all the questions. Again, we will have a lot more information and communications coming up on this, but I do kind of want to get through this, and then we have some other changes to discuss. So on the reimbursement side, because this is going to be important for you, especially if you have bills, it's a reimbursement, so they're not paying for the cost of the visit at time of visit. So you need to find a provider through the app. When you download the app, you will need to add that provider to your list before you set that appointment, before you go. So it's not, there's like 2 steps. 1, you got to find the provider, and 2, you need to add them to your list. And again, we'll show demos as we get closer to January 1st, but that's important so that Garner knows. Garner will have a feed with UMR directly, so this should be seamless, but I want to make sure that you understand those steps. So you got to find a provider, you got to click on them, add the list, you go and have your visit, and then you get reimbursed. Reimbursement does take about 6 to 8 weeks to come, so there is the opportunity that you may receive your bill before you get the reimbursements from Garner. 2 things on that. 1, you can pay it and then pay yourself back with the reimbursement. Or 2, if you want to be patient, you can wait for that reimbursement and then use those reimbursement dollars to pay for your visit. Just know that the providers might get squidgy, they might send you letters, but that's your personal preference. So you can either pay on the front end and get reimbursed, or wait for the reimbursement to come, but it does take about 6 to 8 weeks for that reimbursement check to reach your covering your full deductible, so $2,000, $4,000 for family. It will cover all of your RX expenses if that prescription comes out of a visit with a Garner doc. It covers office visits, physical therapy, imaging and lab work, urgent care. If you find an urgent care provider through the Garner app, it will cover those expenses, and hospital bills that may come during a surgery or other procedure. One item of note, I have to say it every time, I do hope this is common sense, but if you're having an emergency room type episode, don't go on Garner, go to the ER, okay? It's not gonna help you anyway, so just please, if you need to go to the emergency room, go to the emergency room. I understand that your out-of-pocket's gonna get hit, but Garner is not designed for those types of services. Sorry for the typo here with Weywager Fremont School District, but eventually you will have your own QR code. Again, this isn't going to be live. You're not going to be able to search anything on here until likely the beginning of December. And again, this is going live January 1st. Once we do go live, please download the app. You can find your doctors, create your list, and then check your list. Anytime you set an appointment, do make sure you kind of go in and check. It's kind of the same thing with in and out of network. You should always check to make sure your provider is in network. You should also check to make sure your doctor is still listed here as well. I think the last thing here on Garner is there is a concierge service. They are stateside. They're Garner employees. They're not overseas call center or anything like that. You can do an online chat. You can chat through the app, or you can give them a call. They are there to help. I know that technology can be difficult at times, so they're always there to help if you should have questions, okay? All right, one other housekeeping item. If you have a flexible spending account, please do not use your flexible spending dollars for dollars that are going to be reimbursed by the HRA. The IRS views that as double dipping because you're now using two tax-free accounts to pay for a service. That could impact you if you're ever audited by the IRS. So if you have an expense that's going to be covered under the Garner program, do not use your FSA dollars to pay for that. You could use your FSA for dental, vision, prescription drug costs, other over-the-counter medications, but no double dipping. All right. Yeah, go ahead.
When we meet with that person about deciding whether we should be on our spouses, will they have access to the Garner app so that we can find out whether our current doctors are on that?
No, they will not. So that is a little bit tricky. No, they're not going to know who the Garner folks will be. Yes.
How often do the Garner providers change? Like, are they changing frequently at all? Or
No,
are they never changing?
not really. I would say Garner probably updates their system maybe once a year, but it's always just a good practice just to double check before you go in. Okay. Yep.
If we enroll in the family savings plan, we wouldn't use the Garner now, I don't need to.
Correct. Yeah. So the question is, if I enroll in family savings plan, do I need to worry about any of this? The answer is no. Under the family savings plan, you do have to go to the network health in-network doctors, which are going to be Ascension and Freighter and Children's Hospital. So if you're going to Aurora today and you want to stay within the Aurora system, family savings plan is not going to be the best solution there. So that is one thing to consider. But no, if you are enrolled in family savings plan or would like to enroll in family savings plan, you do not have to utilize Garner. Okay, SmithRx. This is our new pharmacy benefit manager. This went into effect already this past weekend, September 1st. I just want to pull out a couple of things. First of all, you should have all gotten new ID cards. If you got some mail from UMR, hopefully you didn't throw it out because it's got your new ID cards because we did switch pharmacy benefit managers. If you have not gotten your ID cards yet, please let Maria know and we'll get in contact with UMR to figure out whether they were sent or maybe somebody got missed. We can also get you an electronic ID card, but that did switch. So next time you go to Walgreens, CVS for your prescription drugs, you're going to need to show that new ID card. A couple of things about Smith. One, Smith is different than most pharmacy benefit managers in that their goal is to get you the lowest net specialty medications, and there's grant programs available or manufacturer coupons. Where I'm going with this is if you are taking certain medications and either the pharmacy tells you it's denied or they're going to ask you to make a switch, if you get communications in the mail from SmithRx, please read it, okay? Because what's likely going to happen is we have a grandfather period of 60 to 90 months for most of these, 60 to 90 days, excuse me, for most of these programs, where the first couple times you go to the pharmacy for those medications, it's going to be covered, but eventually that's going to get turned off and SmithRx is going to ask you to get engaged with one of their programs. So if you are getting either letters in the mail, or if your email's on file and you're getting emails from Smith, please pay attention to that, because eventually it's going to impact the way you get your prescription drugs. The other thing I want to be very clear on, these programs that I'm going to walk through at a very high level, is going to impact less than 6% of you. So for 94% of you who are taking your normal, maintenance medication, you can still go to Walgreens, CVS, Costco, Walmart, wherever you're going to get those prescription drugs. It's not going to impact you. But for some of those higher cost medications that you may be on, you may be impacted. So again, please, if you're getting communicated with Smith, getting communications from SmithRx, please pay attention. I don't want you all to go to the pharmacy one day and then you can't get your prescription drug, and now we're scrambling. So just be aware that this change did go into effect. Again, most of these programs have a 2 or 3 month grandfathering period, but we want to make sure that you get access to the therapeutic care that you need. So a couple common questions: which pharmacies are in network? SmithRx has over 83,000 pharmacies in their network, so we shouldn't have a network problem. Again, CVS, Walgreens, Walmart, Costco, wherever you may go, should be in the network. If you are currently getting your medications via mail order, you can continue to do that. Just know that the mail order provider is switching. It's now Amazon Pharmacy Home Delivery or Walmart Home Delivery. So you may need to communicate with your doctor to get that switched, get that prescription sent over to either Amazon or Walmart. Your doctor's office should be used to this. This happens all the time in insurance, but you will need a new mail order provider. If you are on a specialty medication, so the best way I can describe a specialty medication is if you've seen a commercial for it, you need to change your specialty provider to either Kroger Specialty Pharmacy or Sendera, and there's numbers here as well, and your provider will help set you up with that as well. The formulary is what tier every medication may be in, whether the drug you're taking is on the formulary or excluded, and if it's excluded, what other medications in that therapeutic class are available. You can go to mysmithrx.com, create a member portal, and have access to that formulary as well. The USI team also has it, so again, we can send it to you directly if you need it, but you should be able to go on mysmithrx.com, sign up, create an account, and manage your medications there as well. If you had a previous prior authorization for a medication, we did try and do a historical claims file from your old pharmacy benefit manager to the new one. So the goal is if you've already had a medication that was prior authorized, you should not have to do that again. There are always exceptions to this rule whenever you make a switch. So if you do need a prior authorization, again, your doctor's office should be able to help with that. And you can also either email SmithRx at help@smithrx.com or give the number on the screen a phone call, and they can help. Same thing with step therapy. Also, if you need to go and get a new copy of your ID card, at least specifically around prescription drugs, you can go on the SmithRx portal as well. So again, here to help. You can chat online, email, phone, or go on your portal. So again, this went live already over the weekend, September 1st. So please, if you're getting communicated from Smith, please pay attention, answer it, and hopefully we can avoid any emergencies at the pharmacy. Questions about Smith? All right. Another initiative that is moving forward, and this will impact potentially your health insurance premiums for January 1st, 2026, is we are implementing a primary care physician engagement program. So currently, your health premiums are at 12%, right, Marina? 12% of the overall cost. In 2025, so beginning the end of this year, let's call it December 1st through November 1st of next year, you need to go see a primary care doctor, you and your spouse who may be on the district's health plan. If you do not have a primary care office visit in that time frame, your premiums will go from 12% to 24%. So quite a rather big jump in costs. But you should all be getting your annual physicals done every year anyway. So again, if you and or your spouse are on the district's health plan, you need to get that annual physical done in the next 12 months beginning towards the end of this year. All you need to do is we'll have a physician engagement form. It'll look something like this. All your provider needs to do is sign off that says, yes, Alex had his annual physical. We don't need records. We don't need to know how the physical went. We don't need any medical information. We just need to know that, yes, Alex went to the doctor, and then you will get the same 12% premium. So hopefully a rather easy step. The reason we're doing this is because USI has done a study over all of the employees that our clients insure, which is about 3 million employees, and just having a primary care office visit reduces health costs by about 10 to 15%. It reduces emergency room visits, it reduces inpatient stays, just by having that primary care relationship and having that annual visit. So again, we're trying to do it. I know it's maybe a little bit punitive with the premium upcharge, but again, we're trying to keep you all and your families healthy, and overall reduce our overall costs. So yes. Yeah, let's do December 1st, 2024 through November 30th, 2025. So in that 12-month time frame, you need to have your annual physical. So again, I know some people might say, well, I just had mine. Well, you have 12 more months before you go back next year. And you can go once a year in any calendar year and still have that visit covered at 100%. So again, you should not have any out-of-pocket costs associated with it.
Where should we send that information that we get from our primary care doctor to everyone?
There will be a form available in the admin office, and you just need the provider to sign it. Again, they're used to doing this. A lot of employers are implementing similar programs.
Then we give that form back to the admin.
Yep.
Okay, and then it's everybody that's on the plan.
Not everybody, so dependent children are excluded. So it's only adults, so yourself, and if your spouse is on the plan, they will need to get engaged. But if you have kids, even if they're adult children, they do not need to comply. This is just you and maybe your spouse. Yep. Excellent question. So the question was, is that the same for the Garner program? No. Everybody, children included, can go through the Garner app and should go through the Garner app. So if you need a new pediatrician, or my son's got to go see the ENT next month, we would want to go through Garner to get that set up, even for children. Yep.
Does this visit you refer to include physicals, or is it everything after that for sure?
Yep, just your annual physical. So your preventative exam. So again, this is not, I went to my primary care office for, I think I have strep throat. This is my annual physical. We want to check off the box, and it should be covered at 100% again due to the ACA. So. Okay. I think that might be it. Either that or this side. Sure. So the comment up here was, can I talk about Teladoc? So Teladoc is available through UMR. I have 2 small kids at home, and Teladoc is the greatest invention ever. Because my kids get ear infections, they get pink eye, and all the other junk that comes home from daycare. And instead of going to the doctor's office, I just go on Teladoc, talk to an actual doctor that's licensed in the state of Wisconsin, and they can send me right to Walgreens to pick up the prescription. I didn't have to drag the kids to the urgent care. So it really is, it's available. It's at a much lower cost to you. Is it free? It's free, so it's a free visit. All you'd have to pay for is your prescription drug, so you don't need to go through Garner for Teladoc. You can just use Teladoc. Think of it as your urgent care type needs. So again, pink eye, infections that you know are coming, sinus infections, those types of things, you can talk to a doctor, get a prescription, and go on your way. It also works if you're traveling. So if you're on vacation in Florida at Disney World, my favorite place in the world, but the kids get sick or you get sick, you can call Teladoc, covered at 100%, and they'll send you to a local pharmacy. So it's there wherever you are, and it's free. So free is good, and it'll kind of keep you on your way. Yep.
When you go to urgent care, you don't know who the doctor is going to be. So is that based on facility regarding Garner? I mean, how would you know? You don't know till you get there or after.
Right. So you would search by facility, and they'll tell you which providers to go to or which facilities are performing better. So again, if I have an urgent care visit, I'd probably rather go through Teladoc than going into urgent care. But you can always try and go through the Garner Doc and find an urgent care facility, and they'll send you to the top providers.
So facility. Yeah, but you don't know if that top provider is working.
It's true. Yeah. So what I do want to point out is Garner is really designed for the things that are much more planned. The urgent care, the ER visit, the emergency definitely off the table. But urgent care might be tricky too, because you're right, you might not end up in that provider's office because they could be rotating, they could not be there. So urgent care type stuff's probably not a great fit for Garner, but your office visits, your specialist visits, etc. Yeah, we'll start here.
So for the Garner, so say you start seeing a doctor with Garner, does that only come with that first visit or is it every time you go see that doctor?
Every time you see that doctor.
I know we use that, we use diversified benefits for FSA. Is that still the same way forward, or does it do FSA?
Still will be with diversified. I will tell you, if you know your deductible expenses are going to go down, you may want to alter how much money you put in your FSA, because the FSA is still a use it or lose it provision. Dependent care, yeah, you're going to blow through that. Anybody who's got kids in daycare, max out your dependent care FSA. That's the best piece of advice I can give you.
If you have a specialist physician, say in Missouri, and he's your primary person, but your follow-up visits are with the physician's assistant, how does that work with Garner?
If it's coded through the same provider, it should still be covered because it's going to be under the care of that doctor. A couple of other things that not exactly pertinent to your question, but that spurred is if you or a spouse or a child is going through an episode of care right now, I'll use the worst case example, cancer, and they're going through treatments, and that treatment may begin in December. There will be a continuity of care provision that will get that covered, even if they're not going to a Garner provider. We're not going to disrupt that level of care because that's probably not in the best interest of the patient. So there will be provisions to help with that, but anything that does occur, later, we would, encourage you to get involved with it. But for some of those more serious medical conditions, we're not going to try and disrupt providers at that level.
So when you're talking about emergency care, going to the ER, is that something that we could check up front though and find out what hospital would use Garner, or is that straight?
If you're truly having an emergency, just go to the ER.
But I mean, like I could find out what hospitals are with
Better
Garner.
performing. Well, the thing is, Garner is going to be with every hospital because what we're trying to do is get down to the individual physician level. So, Aurora's going to have docs in there, Freighter's going to have docs in there, but it, may not be. Emergency room's tough. Just go, figure it out later. We want to make sure you're okay.
Is, will it show if you're, like, let's say I have a primary care physician and they're top provider, but they're not accepting patients, but I'm already a patient, will it show up there?
Yes, but what you will need to do is work with Garner because it's not always going to spit it out in a search, especially if they're not accepting new patients. So the question was, what if I'm seeing a primary care provider, but they're not accepting new patients? Is it still going to show up in the Garner app? When I do an initial search, it may not show up because, again, they're only going to show you providers that are accepting new patients. So what I would encourage all of you to do is once the app goes live and you download it, interact with the concierge team. I'm seeing Dr. Smith at so is they will add them to your list and you won't need to switch providers. But if I just look, it may look like my doctor isn't a provider even when they may be. So, you know, we do need to do a little bit of work on the front end, especially if you don't want to disrupt that relationship. So that's a really good question. But you can engage with the concierge team.
Does the doctor know if they're for that?
Likely not. Likely not.
So prior to December 1st, can we call the concierge?
No.
Can we get this rolled out prior to December 1st?
No.
Can you repeat the question?
Sorry, the question was, are we going to be able to access this before December 1st? And that was no. And then the secondary question was, can we roll this out before January 1st? And that answer was also no.
December 1st for the gardener, so he comes out and calls the concierge.
Correct. The reason that it's rolling out January 1st, and then from there, the back date of when the program is going to be live, is to coordinate with our annual deductibles.
So I think the big issue with not knowing until December 1st is that we have to fill out like what the spending and make other decisions before. So if we have to do that, if we don't, then it's here.
Yes, I guess the question is, though, are you going to be willing to switch providers in order to take advantage of this program? If that answer is yes, then you can kind of start to plan ahead. If the answer is I'm going to stay with my doctor no matter what, then to your point, it is a little bit more difficult to plan with the FSA. But if you know, hey, I'm going to do whatever it takes for me and my family to see the best doctors within our network and get my deductible expenses to zero, you can still plan for that. No, it's okay.
Maybe this is a question for Maria, but in the past, our flex rolled over. Is that one?
That is still the same. We're not changing anything with the flex. So the question was, you know, in the past, our flex rolls over. I believe it's $500 a year, correct? That's not changing, so that's going to continue. Well, it is for $500, yes.
Does the gardener list include nurse practitioners as well as and
So the question is, does the list include nurse practitioners or is it doctors only? I'm going to tell you what it should do, but I have had issues with it. It should include nurse practitioners. If your nurse practitioner is not showing up, please contact Garner. It should include all primary care providers. I will say that nurse practitioners have been tricky with the technology. But that's a good question. I see a nurse practitioner for my primary care. So.
Can you tell us why they're considered good doctors?
It's based on outcomes. So they measure outcomes. They have all the patient records for, okay, this person saw, 3,000 patients last year, and how do they stack up against their peers in terms of outcomes based on individual insurance data, Medicare, Medicaid, et cetera. So they're using all of the data available to them to measure their outcomes. Yep.
So our individual premiums are going up, you really haven't hit about the 10%, like after, so if, you had research or whatever. I'm just, I guess, more concerned about the 10%. How does that affect the program?
Yep, so the co-insurance will apply no matter if I see a Garner doctor or not. So that is increasing from 5% today, which it is. So it's going up 5% to 10%, up to your out-of-pocket maximum. So the only thing that's impacted is the deductible and some potentially prescription drug copays. So yes, those costs are going up.
And what is the max out-of-pocket for this year versus this new plan?
So the out-of-pocket maximum is not changing. That's remaining exactly the same, which is $6,850 per individual or $13,700 per family. And that's exactly the same as it is today. That's not increasing. Yep, and then Maria just asked to remind you all that premiums are going up 11%. So those amounts will be coming out. Did you send one already? Yes, and they should be on the summary sheet that Maria sent out. The other thing that I want to mention mention on the out-of-pocket maximum piece is the good news here, if you want to be an optimist about it, is your deductible expenses count towards your out-of-pocket maximum. And if I'm getting my deductible reimbursed by Garner, my $2,000 individual deductible, even though I'm getting reimbursed for it, it still counts towards my out-of-pocket maximum. Where today, you have a $500 deductible, and then everything else applies to co-insurance. So here, if I engage with a Garner doc, my out-of-pocket maximum actually goes from $6,850 to $4,850. And then I would still pay 10%. So I would still need, $48,000 in medical bills to hit that out-of-pocket maximum on an annual basis. So hopefully that helps, but I do know that if I have a larger co-insurance, I'm more likely to hit that number. I get that. But the good news is if I engage with a Garner doctor, even though I'm not paying for it, Garner is, or the HRA is, it still applies to my out-of-pocket maximum. We're at about 7:45. I have time for questions, but I know you all probably need to get to class. So, and there goes the mass exits. Well, thank you. I'll stick around for questions, but I do want to be cognizant of time. Do you have any closing remarks?
Before everyone leaves, I'm sorry. Alex was already dismissing. He's taking the teaching role. This is great, wonderful. Again, we will continue that frequently asked question page out there. You will be able to contact Alex at any point in time for further questions, because I'm sure there's going to be questions as soon as you leave here and you think of those. Please feel free to contact the district office. Those forms we'll have ready soon and shortly as well, so that you're ready to go when we hit the new year as well. So just be cognizant of it. We realize this is a change, and this comes with some potential shifts in what you do and how you practice. This all comes back to the same thing we were talking about at the beginning with our operational referendum, and making sure that we're being cognizant of our taxpayers and all the people who are part of our world. And we are really trying to mitigate the amount of monies and keep it as best as we possibly can, to keep in mind of that and keep our costs down at the same time. We are still, as much as there is a change here, if you look at plans on the average within the state of Wisconsin, we are still right in the middle of that average. We are not super low, we're not super high, we're right in the average state insurance plans going on right now in most school districts. We have been fortunate to have a really amazing Cadillac plan. That cost, however, is too detrimental to not only you, but to district costs overall. So this is some of that impact and the why we're making these moves and making these changes. Please continue to have conversations and dialogues not only with us, but Alex as we move forward. Again, we understand that change is a major shift, but we're here to help and support along the way. So without further ado, we will release you at this point in time. If you have any further questions, please let us know. Alex will stay for some more questions at the end here. Thank you.